to the Shut Your Mouth podcast. I'm Bree. We're a health and wellness podcast with a heavy focus on sleep, breathing, and airway. We are chatting with leading experts, sharing patient journeys, and getting to the root causes of issues plaguing our society. So shut your mouth and listen up. I could not be more thrilled. I saw that I was getting to sit down with you, Dr. Hale, today, and I was like, oh, I get like her all to myself for a whole hour.
No, it's so exciting.
And even though you need no introduction, just in case someone's listening has not had the opportunity to meet you yet. So Dr. Kalli Hale is the Airway Center Dentist on Instagram. She owns multiple thriving, life-saving airway practices all across Houston. She is the co-host of the Sleep Well Journey podcast. You can find, I think, on YouTube and maybe a few other platforms she'll fill us in. And on top of this, you are traveling all around the world, speaking and training other doctors and dentists with this life-saving modalities and the way you do it. And so that is so exciting. And then somehow, even more so on top of all this, you're a mom of three. So no clue how you do it, but I'm so excited to have you.
It was such an honor to get asked to come on. I am a believer and I love what I do. And our mission at Tooth Pillow and all of your help in the past is just I'm so grateful for it. And thank you for having me on. That was a great intro. I was like, I just wanted to be like, oh, that was so nice. Yeah. And I love this stuff. And it is so important to be talking about it. I think the more we can get this information to mamas and dads and families, the more these kids are going to be healthier and thrive, which is really all that matters at the end of the day. It is all about the kids.
Yes. And that's like the perfect segue into this conversation. So this is episode 3. In the first episode, we got the kind of intro from Dr. Ben, the how, the what, how did we get here? And then the second episode, we chatted with Brittany, and she kind of introduced us to myofunctional therapy. But I feel like now getting into episode 3, it's time to like go deeper into these symptoms, because we touch on the symptoms of, signs to look for your kids who may have some sleep disorder breathing. But there's times I feel like parents don't quite yet grasp just how detrimental it can be to your child.
Right.
And there's just new information coming out constantly. And I just wanted to go, it's back to school time right now. My kids start tomorrow, which is super exciting. And next week for yours.
Mm-hmm.
And so as a parent, we want our children to be able to thrive in school.
Yes.
And also with going to school, a lot of families struggle with behaviors in school. That was me. Absolutely. And my youngest, Rowan, pre-K, was not our year. We struggled. And it felt like every day was something new. And this sweet baby just could not regulate his emotions. And his outbursts were so extreme. And to be honest, getting him into a tooth pillow, getting him sleeping through the night has transformed him. And so I kind of want to talk about that. Like, do you mind elaborating on behavior and sleep and how they go together and just kind of dive down that?
And I love to tie this in with school starting, because we need our kids to be good learners, and we want them to be good learners. So we want them to succeed. We want them to be able to get through an entire day at school. And I'm sure part of the issue with Sweet Rowan during pre-K was he wasn't rested enough. And then he has to be there for a large majority of his day. And then they're tired and cranky and they want mom, so it's just like this cascading events. And so, our sleep is critical to our behavior. It is the absolute regulator for how we will wake up the next day and feel refreshed, how our brain processes memories, how less fatigued our body are, how much less inflammation is in our body when our sleep architecture is appropriate. So, there is so much evidence in that regard. Nobody can deny it. But I think it's just important to know that when your child is not getting enough sleep, they are not going to be good learners. They're not going to be able to tolerate the day, sit still in class, and listen and absorb what they're supposed to be absorbing. And a lot of the times, unfortunately, a really tired child is going to manifest as a hyperactive child. And, in our society, that hyperactivity is typically treatment is typically delayed until it gets to a point that the school has to react and talk to the mom, and they have to see the therapist. And sometimes that means medications. A lot of times that means the suggestion is medications, when if there was one thing I could change, it would be that no child would be put on psychotropic medications prior to having a sleep study, because we just need to be recognizing what is the real issue here and treat it as minimally invasively as possible.
Yeah, I agree with that. And I think we should start like a petition and like start, well, you're already doing a beautiful job of it.
Yeah.
That with Rowan, I was that mom where, of course, I don't want my child on medication, but I was so tired. I was so defeated that I would be willing to try anything at that point. And I'm really grateful that I was able to meet, incredible doctors like yourself and learn that there's a relationship. I had no idea. And I think there's so many parents out there that just had no idea that there's a relationship here, because I would have told you my son was a good sleeper.
Yeah.
Because I send him up the stairs. I say good night. He doesn't wake up till the next morning. If it's summer, he can sleep a good 12 hours. Now, some of the things I did notice when I would wake him up is he's twisted in the sheets. He's on the floor. He's sweaty, right? I can see the sweat on his back from where he looked like he was wrestling a bear at night. And I just hadn't realized, like, oh, that is a sign that the quality of sleep isn't good.
Absolutely. Yeah. So my daughter had very similar experiences, and she'd be every angle of her crib. She'd be upside down, a leg up, like everything you're saying. And these are things I hear every day from my patients too. And the sweating, the nighttime sweating when they have sleep disordered breathing, is a fight or flight response. And she would just be drenched. Her hair would be soaking wet. And this is so, even then when she was that little, she's 7 now, and she was 1 when I was noticing this, and nobody talks about that. And certainly nobody talks about it as being something like we need to be concerned about as a parent. And I remember Googling it and finding oh, she must have just had a crazy dream or something, really weird stuff. It was never you need to see an airway dentist. This could be a breathing and sleep disorder. This could be poor oxygenation. And this is how your child's body is reacting to that, which I just wish was the number one thing that would come up on Google. Same with bedwetting, of course, and things like that. We have to associate that appropriately and at minimum, rule out underdeveloped jaws, which just means if you're not in the right provider's office or you don't know to even ask for that, you're never going to get that information. And interestingly, like you just said, of parents, not knowing and how we need to spread that message. I had a patient in my office last week, and she was the sweetest little girl, first grade, and she was on bedwetting medication. I do think that was the youngest, 6.5 years old. And she was also diagnosed with a severe behavioral issue of oppositional defiant disorder, which is a more hot topic now. I feel like I see a lot more on social media surrounding this topic, and people trying to give tips and tricks and stuff to help. And it's just a really sad situation, because that mom has exhausted incredible amount of finances, a crazy amount of testing, and to no avail. She told me we actually stopped the medication because it wasn't doing anything anyway. So they just stopped using it. But this little girl, they had to rule out everything. Her bladder was working fine. Her kidneys are fine. The ureter and the urethra are working. But there was just nothing coming up. And so they were just left with nothing. And she told me, she said, I was laying in bed on social media, and she happened to come across a reel of a myofunctional therapist talking about the link with bedwetting and using myofunctional therapy to improve it. And she was just floored, also fairly upset, because she had gone through all of this for so many years with her daughter, with the top people that you can go see for this problem. And nobody ever mentioned myofunctional therapy. She didn't know what it was. Nobody mentioned myo, underdeveloped jaws, all the stuff that we're talking about. And she immediately got an appointment for myofunctional therapy, and they immediately sent her to have a screening done with an airway dentist. And I think I was her 3rd consultation or whatever at that point by the time she'd come in. And when I tell you, this little girl's development would have just made you cry. Her lower jaw and upper jaw distance was extremely exaggerated. She was what I would say now, having treated so many kids with oppositional defiant disorder, is she had the same presentation of underdeveloped jaws, and subsequently, after we did a sleep study, sleep apnea.
That is heartbreaking.
Really
and I feel like I've been in her shoes, and there's so many moms there that are just fighting so hard for their kiddos. And when they find the solution, it feels like almost such a simple solution, kind of, and you're like, where has
Right.
this been? Because it's not invasive,
Absolutely.
not pharmaceutical. Like
Right.
how come we weren't told to start here? It does.
Exactly.
It makes you so angry. And
Yes. Yeah.
and like you said, there's so many kids that are suffering with this.
Right.
I
And it's
hear,
unfortunate that she had to find that out on social media, but it also goes to show you how powerful that is. And like what we're
yes.
doing with Tooth Pillow and our virtual stuff and just constant content on the
Mhm.
interweb so that these moms and these parents, these families can start demanding this sort of treatment.
Yes.
Which is the most important thing of all this to me, because I'm like, if there is no way to change the opinions and perspectives of every single physician and dentist in the world that these kids are going to see, that's just not going to happen in the next 10 or 20 years, I don't think. So at this point, we got to go straight to the source, which is to go to the families with the evidence and with the information.
Yeah, and that leads me to my next question. I will say that for the most part, Toothpill has really been welcome with open arms because we are doing the Lord's work, is kind of how I feel. Like we are, really at the forefront of just getting this information out there and helping thousands of kiddos. And I will say, I'm so thrilled that our airway community is passionate and excited about what we're doing because they know what this means for these
For
kids.
sure. Yep.
But there are a handful that are maybe have some naysayers out there that are like, whoa, what are you doing? I don't know if it's a threat. Maybe we're going to take their patients, which that to me is like, whoa, there's so much to go around. There's such a need.
Absolutely.
But
Right.
what are your thoughts on that? What do you say to those providers out there that maybe
Yeah.
are concerned with what we're doing here at Tooth Pillow?
I think I'm really glad you asked me that. I've had some really great conversations, constructive conversations with doctors that are just like, okay, what are y'all doing? Like, just, come to the source, which I always appreciate. I would rather them DM me, email me, call me, and get really truly the accurate information about this company than just hiding behind a keyboard and commenting on something they don't really understand. So I would say that in my experience so far with this, there's a lot of misinformation, for one, that is necessary to clear up. I was talking with a dentist actually, and she told me, she's like, hey, so I'm in this group and somebody posted about a tooth pillow patient that was actually denied virtual care because of the severity. And she was like, I just want you to know that nobody knows that you guys deny cases. And I was like, wow, like, part of our conversation was like a little bit, difficult in other aspects, but I was like, I am so taking this in because this identifies what we need to make sure we portray better on our website and just better in general to the community, because we are not a one size fits all, every single kid. We just say, yes, and here you go. This is the solution. And so I think that's important for doctors that are listening to know, and other allied health providers in this space, that if I do not deem this child appropriate to have a tooth pillow appliance, whichever brand it is that we find appropriate for their jaws, we are not going to say yes. And I also think it's important for them to know that we are not promising people they're not going to have phase 2 braces. Like, that is so incredibly clear on our information. And I don't want the providers to think that we're misleading these parents in any way. I mean, the parents understand we are promoting converting the patients to nasal breathers. So redirecting the breathing, redirecting the musculature. And honest to goodness, the side effects of what we do is cosmetic. So if the teeth align perfectly straight or improve greatly, like, that's a side effect of us working on nasal hygiene, nasal breathing, myofunctional therapy, and again, redirecting the breathing and musculature. We are not a total replacement for expanders either. You and I were talking before, like, what about expanders in your practice? I mean, there are so many different solutions for this problem, this global problem of sleep disorder breathing and sleep apnea in children. We are just on the tip of the iceberg of getting the information to the parents, screening these children before they ever spend a dime, and making sure the parents know exactly what they are going to get with this treatment. And so I think a lot of that naysayer just comes from comparing us, unfortunately, to companies that we don't agree with, like Smile Direct Club, and then eventually going bankrupt. It has taken teledentistry and that whole virtual care model, at least for dentists, and tarnished it. So it's easy to just get swept under the rug with everything else. Like, oh yeah, they're just mailing these little blue mouth guards. Like, what are those going to do? And it's just unfortunate. And I think it just shows, better communication on our part about who we are and what we do.
Yeah. And I think I want to start highlighting all of our providers and making sure the patients are realizing the level and quality of provider that's overseeing their child virtually.
No, yes, that's so good.
I was on a webinar with Dr. Hansen, and we've been trying to do these where he gets to kind of meet with his patients and just talking about his practice and the quality and the level of education that he's gone through. And he's pretty well, all of our doctors are well known in their communities, right? Like they are known and they are hard to get into. They are the best of the best. And like I remember when we became tooth pillow patients, long before I worked for tooth pillow, I was like, there's no way like Dr. Kalli Hale's our doctor. Like it was so exciting. And to drive 5 hours to you had been impossible. Right. And, helping patients, highlighting them, spotlighting them more, sharing more about their practices and all of the extended education that they've gone through.
So important. Yeah.
And, it's so great when, we're on these webinars because almost every parent goes, well, what about me? It's like, well, perfect. He's right here in Oklahoma.
Yeah. You do get that a lot. The adults are seeking. I mean, I can't tell you, I literally get hundreds of DMs. Where can I find an airway dentist? And my husband snores and I need this and that. And it's like that network is everything, which is what we're building at Tooth Pillow to connect them to the right providers. And it's a powerful, powerful thing. I think the mom community in itself could change the world if we wanted to, right? And so it's wonderful. And it is important for them to know that their dentist is a real person, a real practicing dentist who is very busy every single day treating patients at their own practice. And it is not just somebody hiding behind a computer or some sort of robot or something. It's not. It's a real person. I take it very seriously when I look at these check-ins. I'm going to ask you if they're wearing it, if you're doing what you need to do. And if you're not going to get the same results. With the tooth pillow appliances, compliance is key. And if you don't get the changes that we're wanting, you're going to have to go in office for expander treatment. That is just fact. So it is definitely a lot of work on the moms and the parents, more so just on the front end though, because once the kid gets used to it, it's like, oh, it is life-changing over that period of time.
Oh yeah. We just say, brush your teeth, put your tooth pillows in, and we don't think about it. And now we're at a space where I'll just be like, oh, you wore your tooth pillow last night, right? And they're like, yeah, I did. And so it's just like, yeah. And then
you built the habit. Yeah.
Yes. And once you start to see the change, whether they're visually, which those, of course, we love to see when that tooth kind of straightens up, but the symptoms, because and maybe we can kind of get back to that a little bit too. The sleep and the behavior. Hold on, let me think where I'm going with this. Is just there we go. Came back. Because some of this is irreversible, the damage. Right. And so I was wondering if you can talk to us a little bit about that, like just how if you don't catch it. Yeah.
Yes. Yeah. So in the beginning of this year, I'm a diplomate through the American Academy of Dental Sleep Medicine, and I attend their annual meeting every year. And this year was a critical meeting because they had an entire extra day that we had to pay extra for to attend the pediatric section. And it was advertised as a pediatric debate, and it was a pretty hefty debate. We had both sides of the table there. Those that believe nothing about musculature and breathing, which was really hard for me. I tell you what, it was really hard for me to sit there and listen to the opposing view. Any of my friends and colleagues that were on the same row with me, they were probably like, we are not sitting with Dr. Hale next time, because I was clicking my pen and anyways, it was a lot for me. But our side, the airway side, won the debate thanks to the incredible Dr. Audrey Yoon. No doubt, she just completely owned that space. But we did get the opportunity to listen to an incredible physician. His name is Dr. David Gozal. Everybody should look him up. And he presented us with some really new information on pediatric development and neurology and some crazy scans and stuff they're doing on kids to assess the brain development, any sort of brain damage from hypoxia, which means low oxygen, like if you have sleep apnea. And it was a really telling moment, because you could have heard a pin drop in that room, because this is the physician telling the dentist, you better go save these kids, because what you don't realize is that we're not sure this is reversible. And it was like, I mean, I was just silent. I was like, probably like this, like, this is what I've been saying. Like, these developing brains are developing at rates that we can't understand. And we are literally giving them medications that we don't know the side effects for ailments that we think are one thing when it's really poor sleep. Like, I know that was long-winded, but just like going down the whole rabbit hole of like, what are we treating and what is the actual problem? And he can show it on these brain scans when their oxygen levels drop, which is, this is your breathing complex. They call it the nasomaxillary complex. Like, we've got to fix this. That is our responsibility as dentists that are in the space treating pediatric growth and development. So as scary as it can be, and I don't always share that with parents, because I do not treatment plan stuff out of fear. If any dentists are listening, I think that's the worst way you could present this stuff to a parent, but it's still really important to know, because I'm hoping it puts fire under people's butts to be screening, at minimum, be screening. And if you don't want to do it, refer them to the Tooth Pillow website and we will take over after that. You know what I mean? So.
And if you have a mom listening that hears this and wants a sleep study done for their child, this is something I hear often is, well, it's going to take months to get it in with a, in-office sleep study. It's expensive, it's cumbersome. And I don't think a lot of them realize there is an option just through an airway dentist.
Oh, yes.
Very affordable. You want to share about your sleep studies within your practices? Yeah.
So even the idea of a home sleep study is relatively unknown, because we're all used to like Hollywood movies where you're like in the lab and you got leads on your head and around your belly and all that stuff. And there are extensive wait times, especially if people are trying to use their medical insurance. I mean, they'll wait 6 or 9 months to have a sleep study with like one of the major hospitals by me. So, which is just like absurd, and it's unnecessary. And there are so many portable units now where you can actually be in the comfort of your own bed, both child or adult, and do it for a couple of nights and try to get a really good idea of like what your normal is while you're sleeping. And that's an important thing. And at our airway dentist offices, and I would say probably most airway dentist offices, I don't know, I can't speak for them, but in our practices, it is part of our screening. And we use a very simple home sleep test machine. And it allows me to get a really good baseline on these kids. I'm going to treat their growth and development. I'm going to treat their underdeveloped jaws, their nasal breathing, their musculature. But I will use a baseline sleep study to support the diagnosis, and also for really fun at the end to do it again and see that it's better. So yeah, you can definitely ask your dentist if they are in this airway space, if they could offer a sleep test for you or your child, and you will be able to do it very quickly.
Yeah. And you can even, if you're maybe through Tooth Pillow, like we have this beautiful network of airway dentists. So I can look for one near you, see what they charge, and send you in. Because it's so great to have that data in front of you and just to have those answers, because we really don't know. Like I mentioned before, I would have told you Rowan is like the best sleeper.
Right.
I thought he was. I didn't realize that he was fighting for oxygen all night.
Right.
And even more so, like what that does to a developing brain and setting him up for success for school. So,
it's crazy. I always tell parents, I'm like, it has to do with their quality, not their quantity. And but that's a weird thing for us to think about, because we're kind of taught when our kids are little, like they need 10 to 12 hours, like make sure they get 10 to 12 hours. It's not like, make sure that 10 to 12 hours is actually good quality sleep, And what do you look for? I mean, that information is just not there. You want to look for night sweats, and you want to look for them moving all around their crib and their mouth breathing, and do they snore at all? And like all that kind of stuff. That's what you want to be assessing for. So, but if you don't know that, you won't know what to look for. You can't know what you don't know,
And, that's why we're so passionate about getting this information out there to moms, so they know these things, and to know that clenching and grinding is a huge red flag. Snoring is a huge red flag. Mouth breathing is a huge red flag, because I still, on the daily, I'm hearing stories where moms were dismissed when they brought those concerns to
with that.
And I'm like, yes. And I mean, I'm even guilty of it. I've been in dentistry for quite some time, and there was many years when mom would say, "Oh, my little son cried." I'm like, "Yeah, they do that sometimes. They'll grow out of it." I mean, I'm guilty of saying those things.
So was I. Oh my gosh. Yeah. Yeah. I was the same way. One of my biggest regrets ever is telling a parent that their kid snoring was normal and they'd grow out of it. Because that's what I was taught to say.
Yeah.
And I said it over and over and over. I also pulled teeth for braces. I have done the worst of irreversible treatments to a kid before because that's just all I knew. And I was asked to do it. So I did it. And there was just no outside of the box thinking for me as a new dentist. And once I got trained and I have different eyes, you can't unsee this once you treat the kids appropriately. I will never do that again. I mean, nobody refers to me for removal of permanent teeth anymore because those kids did not follow through with their braces. So it just, was one of those things where all of a sudden they stopped happening. So,
and kind of looping back to, our airway community, it's small. And I feel like one of the reasons why there's not enough dentists doing these treatments in office is because of how much conversation time you need with the patient to bring them up to speed and to educate them. And so I feel like Tooth Pillow is kind of pre-educating the patient. So mom knows what to look for. They kind of make all of these, they identify it on their own, and then they go into their airway dentist and they fully understand. It's kind of like if I have a cavity or even gum.
Yeah, you kind of know.
Yeah. Yeah. And so it's not like this 30-minute, 2-hour long conversation where you're delivering really big news to a mom who's maybe never heard this. And also it can kind of be a little bit of a gut punch because you had no idea and you kind of, mom guilt, we do that. Those are really hard conversations to have.
They are.
In your little 30-minute window with your patient.
It is.
And I think that's been a big deterrent of getting more doctors on board with these treatments, just because they're like, how do I fit this into my practice?
Oh, definitely.
And so I love what Tooth Pillow is doing because we are educating them and, helping mom already go down that rabbit hole. So when she goes into the provider and they start to talk to them about it, they already have a good understanding. And so I think that, I don't know, I'm just excited.
It's really important. And I think just like the scenario of this other mom that just happened to be scrolling social media and saw myofunctional therapy reel, the stars aligned and that algorithm worked for her. Otherwise, she would still be out there helpless and hopeless with this sweet little girl that I know is going to be a completely different child once we're done fixing the problem. And it's just a beautiful thing, but that education is key. And I think for dentists that are listening too, I think you just have to make a decision to an extent in your practice that you are at minimum going to screen your patients.
Yes.
Because we just have to screen. Now, there's way too much evidence out there of what we're missing and how it's linked to really detrimental things. And you don't want to be liable for that. And you want to do what's best for the kids. So we need to be asking the questions. Whether or not you want to do the treatment's a whole other thing, but just to recognize when something needs to be referred to another provider, if you don't want to handle it, that is the most important thing. Because at the end of the day, the parents are coming to you for your opinion on how their kid is doing, and it needs to stem farther than cavities.
Mm-hmm. Absolutely. What has been one of your favorite things about watching Tooth Pillow just kind of go and seeing all these sweet babies come through?
For me, it's like I always wanted the name Tooth Pillow to be a household name. Mm-hmm. I came up with that, and I with all the amazing founders, I was like, can we please name this company Tooth Pillow? Because I was calling the appliances Tooth Pillows in my private practice. I felt like mouth guard was awful. I don't like mouth guards anyway, for other reasons. We do a podcast on that another time. But I wanted it to have a really unique name. And when I'm talking to a 4-year-old about how they're sleeping and that I have this pillow for their teeth at night, just like they put their head on a pillow, I just thought it was so great. And to me, just the idea that people all over the United States right now would recognize the name Tooth Pillow to some extent is just a dream come true. Because again, whether they go with us in virtual care or they go in office and get it, it doesn't matter. That kid got what they needed. And it's great for me. I also love, obviously, you are just incredible asset to this company, and the support team that you guys have built is like the most incredible moms and that have had kids go through treatment that are there for these parents 24/7, really. I mean, you do sleep, you need to sleep, but for the most part, they now have access to something they would never have access to. And that was another thing with us building the provider network. It's like they have world-renowned dentists that they would otherwise not know to go find and certainly not have access to in an app, right? And that is just a beautiful thing too, because we are bypassing the barriers. And the quicker we can knock the barriers down to this care, the better and faster the kids are taken care of.
I love that. I just want to talk a little bit just how incredible you are and how passionate and the volume, the level of care you have for these patients that come through virtually. I vividly remember there was a day we were just getting all of these submissions coming through, and you're looking through them, you're seeing these faces, and you like quickly made a little video to the team, just like almost in tears, because you get to see these moms pour their hearts out. They'll tell you virtually, even like all the things that they've tried, how this has just been such a blessing because they were about to have to drive 6 hours or, you know, whatever the story is. Then we're really filling this gap and growing, like you said, the community, whether it's the community of our awesome providers or if it's the community of our awesome families, and just a safe space to support each other and celebrate all of these wins and all of those good things. So it's really cool to see where Tooth Pillow is now.
Yeah. I mean, anytime you're passionate about something you do, and, you know, this has been years to us getting to the point where we have a podcast that you're doing of us and like all this stuff. It's just a testament to how hard all of us are willing to work. And yeah, I had forgotten about that, but I appreciate you reminding me. I remember that day, and I remember just getting chills as I was reading these kids and approving them for treatment, and then getting sad when I have to not approve one for treatment. Just thinking like, people have no idea how bad these kids are suffering. They really do. The providers have no idea. I mean, the traditional providers have no idea what life is like at home for a lot of these families. And if they knew the impact they could have, if they only knew the impact they could have by screening and treating these kids appropriately, they would never look back. You know, I mean, for me, it was a matter of hanging up my drill, and I wasn't doing restorative work anymore. I had just an overrun of patients that needed my opinion on things that were really, really serious in their growth and development, and their breathing, both adults and kids. And it's just a really cool thing to have happen. And I think you need to find what you love in life and chase it, and just knock down any barriers that don't get you where you want to be.
I love it so much. I do think I wake up every day and I'm just like, I'm surrounded by the most incredible people.
Yeah.
And like that love what they do, and they're working really hard, and they care so much about, trying to think how many babies we have in treatment now, but I feel like every single one of them is like so cared for, and we really are so I'm just so excited to see where the next few years take us.
Me too, Brie.
I'm excited, but I'm just gonna ask a couple more questions because I don't want to keep you too long.
Yeah, no problem.
There is one question I see a lot that I don't really have the best answer for, because we have a lot of patients that come to us post-expansion. So they got really great expansion, but maybe mom is concerned with still some mouth breathing habits. And so they're wondering, is Tooth Pillow the best phase 2? Or, you know, I know in your office, you do expanders, upper, lower with the Tooth Pillow together. That's kind of your protocol. So do you mind sharing for our patients that are referred in office, right? We want to make sure that we are referring them to a provider. What are some things to look for? What is your protocol? What do you recommend?
Yeah. So obviously we're yelling at the rooftops that we need to be focusing on both arches. The caveat or the asterisk there would be a severe skeletal class 3 case. So a really large lower jaw, and we need to be growing the upper. But I would say probably 90% of the cases are what they call a class 2, where the lower jaw is too small. Everything needs to be wider and more forward. And so we need to do upper and lower expanders. So I would say if you're in an office and they are not offering a lower, or they look at you like you have 3 heads when you say, but Dr. Kalli said we need a lower, then you just might want to get a second opinion, or maybe reach out to us and we can help. So I did develop the protocols of having the expanders done in conjunction with the Tooth Pillow appliances. And so we do that in our private practices. When the expanders come off, depending on age, so that question you were asking about, like, do we do Tooth Pillow second? really depends on age, on how we finish the cases out. Are they going into a final tooth pillow, which is kind of their retainer until the rest of their permanent teeth come in, or are they going straight into a phase 2 in our practices, which would be with clear aligner therapy? So there's not really like a cookie cutter response for like, what should we do? I would say if your kid is still losing lots of baby teeth and they're kind of like in that what they call mixed dentition stage, maybe they got their expanders off and now they're 9, like, yeah, they should probably go into a tooth pillow, you know? But if we're talking about a 14 or 15-year-old, somebody that's a lot older in age, like probably it's time to get in there and start moving teeth, get in with the myofunctional therapist, make sure there's no tongue tie, you know, just kind of the basic stuff there. So
Yeah, that's really helpful because I see that question come up a lot. And I know this is something you have to handle. It's a hard conversation, but there are a lot of families that have already pocketed or been out of pocket a lot for expansion.
Right.
But unfortunately, it was upper only and they need more expansion. So, what do you say? Because I've personally seen some tooth pillow patients that were referred in office that have already gone through expansion, but we're referring them for more. Do you have any like words of encouragement for those moms?
I mean,
Hard
it's hard because it's expensive and you feel a little betrayed. I don't know if that's the right word, but you just feel like, hey, you know, so-and-so said this was going to fix it. And unfortunately, it just doesn't. And there is a very high relapse rate. And you can find that in the literature. I had a patient not very long ago that came in and she was like, we did the expander and, you know, it was singular. And I was like, oh no. And we're in myofunctional therapy. We need to see you for a tongue tie revision. And I measured the 10-year-old boy and he was actually less than 30 millimeters in between his 2 permanent molars on top, which if you know anything about like what size you should be, like by age 4, you should already be 30 millimeters. So I was just heartbroken because now I have to be the bearer of bad news. It is fine. I can definitely handle that conversation. I think more what I just wanted the mom to understand is that she's paying for my opinion and I have to tell her where I professionally believe the child is right now and what does this really look like for his health as he continues to age and turn into an adult. And so I would say any of the parents that are, you know, in the treatment right now of like, well, now we've got to go pay for expanders again, just know you have to do whatever you can do to make sure that child turns into a nasal breathing adult. And it does suck that like it didn't happen the first time like it should have, but you are so lucky that they're still a child and you can still fix it for less money than what it will be like to fix it as an adult. So the beauty is that you're getting in the right hands and it's finally getting taken care of. And it's just a journey for some people of how they get to that point. And I would say yell it from the rooftops and shout about it so that nobody else goes through that. And I do wish we had more time, you know, to talk about that, but really just there is always hope and we can always find wins in these situations. And we're happy to help you do that.
Yeah. And it's so funny you say that because I'm in all the Facebook groups, right? And it's getting out there because I'll be in, you know, an expander group or something and I'll see, well, per Dr. Ben, make sure you have upper and lower expanders. And like these moms are, you know, sitting at, they're remembering they're sitting at soccer practice and they're talking to their girlfriends who's like, oh, I have an ortho appointment. Well, make sure you get the upper, like just getting that information out there, spreading awareness and stuff. So it's all really good. I love it.
Movement and I'm here for it. You know, I can take the daggers in my back in the meantime because it's all about what's right for the kids. So it's okay.
Yeah. And that's something like just on like a professional level, but just like on a personal level, something I admire about you so much is that you know what's right. You're good at it. You have decades of experience to prove that, or in your practice, and you're willing to take those blows from the naysayers because you've seen it work. You know what's right.
And it also was them in the past. Yeah. So I can look at it from a lens of, I used to think that too, you know, and if you're not there yet, like hopefully one day you will, and on I go, you know, but I appreciate you saying that. I really do. And it's really fun being on here today too.
I know. I love it.
Again, we should do more of these.
I know. I think we should have you come back frequently. I'm going to share this, you know, on YouTube and all the things and find more questions that I should ask you about. But I think that's a pretty good place to let's end it with one more question.
Okay.
So I have moms that I talk to every day, and they are just like, I can't quite move forward with tooth
Mhm.
filler because they're worried. What if it doesn't? What if they won't wear it? What if it doesn't? It's
Oh,
not the solution. And I try so hard to convey is what happens if you don't do it? Kind of like all of the money that you can spend, managing these symptoms. Um, what do you say to moms that are just like, should I do this? Like, is this right for my child? If they're approved for tooth.
so in that case that I was sharing about the sweet little girl that had oppositional defiant disorder, her mom was equally concerned about that with the behavior stuff that she said, we have to glue something in. And I said, no problem. I can definitely do that. But then when I started talking to her about how the tooth pillow works and what a critical component it is to this specific child's mouth and what we need to accomplish, she was just really, like, but what if she doesn't wear it? And I just looked at her and I said, we have to let her try. We have to let her try. So while on one aspect we can focus on what if they don't, I already know what it looks like when they don't. I treat kids 12, 13, 14 and up all the time that never got it early. And I know exactly what it looks like. But to compare that, for a mom who's struggling, it's like, you got to give your kids that chance. You just have to, you've got to try, and we will work with you to help you get from point A to point B. So
Yeah. And that I can speak to. Our girls are so amazing. Like you mentioned, they're moms who've been in it. They've been in the thick of it. We even have, some of our moms who really struggled long term with their kid to get them to wear it. They had sensory problems, and so they know, and they will work with you. And I'm very confident in our support team.
I am too. Yeah.
But this has been so fun. I'm so glad we got to do this.
Me
You're
too.
so welcome. You're just a beautiful person, and I am thankful every day that I get to work with you.
It's so mutual, my friend. Thank you so much.
Thank you.
Have a great one.